Good afternoon. And today we have a pleasure of interviewing Dr. Scott Siegal. Good afternoon, doctor.
Hello, Maria. It's nice to meet you.
I'm First of all, thank you to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program would be for you. Actually, it would be, we were talking about prevention or good strategy, how to establish sleep health for children and for adults as well. And if you're a medical professional and just like us, you're so passionate about sleep health and overall health, this program is going to be for you as well. Only together, people of different specialties, we can put puzzle of this dangerous disease together and find a solution for our patients. And now I'm going to give you short story about my own collaboration, or at least uh, introduction far before we met in person on a panic conference with Dr. Scott Siegal. I heard about him maybe for the last 10 years, and the topic of a tongue tie I was always very curious about that topic. But number one, my personal friend, Dr. Gellerman, trusts the health of her precious granddaughter to Dr. Scott Siegal when she was born, and he did the tongue tie release. But in general, in our world, in our ecosystem, you were very famous for that procedure. But to add the fame to your story, New York Times featured you in that wonderful article about cutting the baby tongue. And after I read that story, I said, oh my God, I have to bring that controversy or find the truth on my channel and interview you in person and find out, is that procedure so necessary? Or maybe, as a New York Times portrait, that we're just doing that for money because we're terrible people. And that's all. We don't care about patient health. We don't care about patient future. We just strictly care about income. So, on that very negative note, we're going to start to find out your story, how it happened, you being MD and DDS and having, broad variety of knowledge, step from, traditional oral surgery, which involve implants and face reconstruction, cleft palate, orthodontic surgery, to specializing on this delicate issue called ties, tongue ties, lip ties, cheek ties. Please tell us the story. What exactly happened? What inspired you to kind of specialize in this particular area?
No, and thanks for having me again, Maria. It's an honor and humbled. My journey started in medical school in my residency program, actually close to 30 years ago. One of my mentors was a pediatric surgeon whose name was Elizabeth, or Betty Carrillos, as her last name was Carrillos. And she developed a classification system for pediatric or infant tongue ties. So I worked with her as in my education. And when I went into private practice, her office happened to be across the street from mine. And at the time, like you said, I was doing general oral and maxillofacial surgery, facial reconstruction, and cosmetic surgery. At the time, I was using lasers for a lot of my work. And she had approached me to ask if I would actually start helping her treat some of her babies that she was using scissors with laser. And she introduced me to this whole world. And it really, I kind of was maybe a unwilling participant, but at the same time, my wife had given birth and we had a baby who was breastfeeding, and we had challenges. And I think, as most of us in these fields, have personal stories. And that really kind of set me on a course to start to focus on helping treat babies with feeding issues. And my mentor took me under her wings and really introduced me. And over the past 24 years, it's just each year has become more and more of an in-depth journey into this area. So I'd say maybe close 5-10 years ago, I really made it a decision to focus solely on this field. and really have kind of shed most of my other oral and maxillofacial surgery procedures to really focus on treatment of tethered oral tissues, so tongue ties, lip ties, soft tissue issues that you know are impacting these babies up through adults at this point.
I would like to ask you from your, experience of the 30 years doing that, tell us, is tongue tie a genetic feature?
Well, there's definitely a genetic component that we do see. We see many of them do run in families, and we see that we'll discuss what's going on with a baby or a child, and as we discuss all of these things, many times a parent will say, "You're actually talking about what I'm dealing with. You're talking about the issues that I've dealt with as a child, whether it's feeding, speech, breathing, snoring, sleep issues, orthodontic issues." And we often see that aha moment, that light bulb goes off after we do a consultation. And we do see many of these, patterns run in families. There are some that just come out of the blue as well. And we're not sure exactly why.
Yeah, but sometimes family is a very intricate thing. 23andMe had a lot of discoveries about genetic predisposition also. But,
100%.
after that New York Times article, what I read maybe 5, 6 times and tried to contact all the journalists on that, who put this article together. And in general, I really like this publication, and I was surprise with featuring two sides of the story, which was only one negative part of that story. So, that being said, how do you determine when it's truly necessary to do frenectomy or tongue tie release, especially for newborn?
Right. So that's not such an always black and white sort of question, or and not an easy answer to always give. So number one, we're always looking at function. Is there a problem going on? And for the vast majority of families that I'm seeing, or babies, or kids, or any patient that's coming in, they're usually coming to see me because there's an issue going on. There's some sort of symptom. So trying to come up with parameters of care and treatment protocols, we're always identifying that number one, there's a functional problem going on, with either feeding, speech, breathing, some sort of symptom. And then we're trying to identify a structural issue that may be correlated with that problem. So for those of us in this field, yeah, we're identifying these restrictions or ties in the mouth, whether it's the tongue or other spots in the mouth that are impacting function. So most often what's dictating my treatment is, coming in with a functional issue. Many times it's been diagnosed or evaluated by someone else before seeing me. So if it's a breastfeeding issue, a lactation consultant is often seeing these families. If it's a bottle feeding issue, maybe it's a feeding therapist. There could be body issues going on. So we see, OT, PT. So many of these families are coming in from someone else prior to seeing me. So I'm usually not the first stop. And then saying that, well, not everything needs to be treated or lasered or, surgical procedure. So we're all trying to kind of come up with, exact protocols on saying who needs to be treated versus not. Then we always circle back to risk versus benefit. If we do see a tie that's evident and we do have a functional problem going on, we've done an assessment, we're working with a functional therapist component, and then we say, well, what's the true risk of the procedure versus leaving these intact? So that's kind of in a general way how we kind of come up. And you go back to that New York Times article. I invited these journalists to sit with the families while we consulted and actually speak to the families exactly about what you're talking about. It's like, how do you determine what needs to be treated or not?
Yeah, but they had already predisposed idea, and they just come up with that other part of the story. But
Right.
on a, I was a patient. I had my tongue released in the age 4, and I had my functional therapy, and I experienced. I was a, I experienced this journey myself, and but being a clinician, I notice we try so hard working with myofunctional therapy, and we notice what sometimes tongue tie heal back not exactly how we want it to be healed, close to the original position, like little bit better, maybe 30% better, but still not the way not the way it was released. It was released fully, but then healing back. So please tell me from your vast experience, why is that happening?
So that's always like one of our number one things that we discuss with families when we talk about risks and benefits. And it's not a true risk, but the things that we're always talking about, one of the biggest things we battle is what everyone terms reattachment. Like you said, when we release a tongue, many times it wants to go back to where it was. And the reasons being, and it's very difficult to, prove it scientifically, but what we find is that, many of these babies up through the adults have compensations. They've been, their muscles and their fascia system have been kind of set at one point. And many of these kids or babies or adults come in, they're very tense and tight. And we find when you do a release, especially if we're not having adequate preoperative therapy, whether it's the myofunctional component and the body component to work on stretching fascia out and making things as loose as we possibly can before the procedure, we find that if you just do the procedure, even sometimes you do it, all these other issues, things want to go back to where they were. So we're constantly battling that. And like you said, sometimes we'll see you do a release, everything's completely loose and stretchy and flexible. And over the healing process of the first month or so, things start to go contract. There's always a component of natural wound contraction during healing, but we find that oftentimes the body wants to go back to where it was in its, either natural resting position or resting state. So there's a lot of us all working, collaboratively to try to help prevent this. So you have the oral therapists, the body workers, the, surgeons and the providers all kind of working as a team to help prevent that.
I would say that philosophical phrase, we're working against the time. Time is kind of stressful.
Mm.
So body respond to the time in time fashion, but it doesn't mean the tongue have to be restricted. But now I want to ask you another question, controversial question from the article. What the primary reason for lip and cheek tie resection and how it's different from tongue tie?
So when we consult with families, especially if we have, well, we'll talk about maybe different age groups, but many times if we have an infant that's struggling to suck and swallow, the tongue component is basically the part where the tongue is moving this. We're hoping to get that nice peristaltic wave-like motion to help form a good suction or vacuum to draw the nipple deeper into the mouth. The lip or the cheek, if there's restrictions there, many times it prevents the lips from flanging out fully to form a good seal. So we look at that seal component and we look at that, suction or sucking component. Longer term, or as kids are growing and developing, sometimes becomes an orthodontic issue where these, a lip tie is attaching. Is it going to be in between the teeth, causing a diastema or space? Potential difficulty with hygiene. There are theories. We see a lot of, babies coming in or older children when we do these releases in the other areas of the lip and the cheeks. It's also releasing fascia tension. So there's all of these little pieces of a puzzle that we're looking at. And again, there's no hard scientific research, but we see improvements daily. We get feedback, and this is not something that's new. This has been going on for years and years. And I think, collectively or worldwide, many of us have seen improvements. There are some, early articles and early studies coming out now looking at releasing lip ties and watching spaces close, by themselves. We see them coming in from speech therapy and feeding therapy all the time, where we're improving, lip function,
Mhm.
better seal. We actually demonstrated in babies when I would just do a lip tie, we were doing ultrasound research and actually seeing tongue function improve with just a lip release. And our hypothesis is we're getting a better flange, a better seal, which is allowing the latch to maintain, even though there was no obvious tongue tie. So,
Mm. No, that's very interesting. I would say the tongue tie is one of the most ancient tongue tie release, most ancient surgical procedure. The midwife performed it with the nail on the pinky for the newborn, because previously when we didn't have all this technology and bottles and industrialization, if you cannot get breastfeed, you die. And going back to this ancient procedure, what cases you determined, what sutures are necessary after frenectomy, and what benefits that provide to the healing process, because for some people, even to hear words sutures, they already get, that's it. No, sutures, that's it, trauma,
Right.
major accident. But for me personally, at least that's what I witness in my clinical practice, I like the idea of the sutures. I think it's less chance of reattachment, but doing it with the laser, then you eliminate the suture idea. So give me your view on the suture
Right.
story.
So that's an evolution too, and we're all kind of changing our practice ways. And, we're not trying to reinvent the wheel. But I think, when you look at open wounds versus closed wounds, open wounds heal by what we call secondary intention. So you leave a space open and you have a lot of tissue that has to, close, and you have more potential for wound contracture or, either scarring or healing back. So if you wind up leaving a wound open, you really have to do what we call active wound management, which is stretching that wound specifically open. Much easier to deal with in infants and babies. That's really not much of a big to do. When we start getting towards older children, whether it's toddlers, children, and through the adults, I think many of us have found over the years of doing this that if you leave the wound open, we're more likely to get it to heal back together or reattach. Versus when you stitch or suture a wound together, it's healing what we call by primary intention, or you're getting those wound edges closer together. So there's less healing or less, what we call epithelial migration,
Mhm.
and potentially less collagen scarring or contracture. We do have very good success, but it's, again, each case is a little bit different. I would say the vast majority of like older kids and adults at this point, I do wind up suturing. We do leave some open, and some of it's preference from therapy, my therapy providers. It's also depending on compliance of a patient, the ability to stretch a wound. It's not such an easy thing to do. Yeah.
It's really against all the odds, that's hard.
Right.
Now, I want to tell my audience, not only you are a doctor who perform the procedures, but you also the advocate for the patient health. And one of your affiliation I want to feature now, it's participation in a foundation called Airway Revolution. And this foundation, not only, doing significant things to educate public about importance of airway health, tongue tie, lip tie release, myofunctional therapy, body work, all these unknown puzzles to the general public, but we constantly talk about it on our channel. But now they come up with a documentary series called Breathless. If you can share with us, and we're definitely going to put the link for the for documentary release, and I really recommend our audience to watch this documentary series and educate themselves about this important component of health called breath or healthy breath. So please tell us about the foundation and this documentary
Yeah,
series.
I'm honored to be a board member, and I'm co-chairman with Michael Gelb, as far as this called the Airway Revolution Foundation, which is a nonprofit organization with the major goal of creating awareness, education, and helping access to care for the public. We all view this as a public health crisis, not, with airway issues and the millions of people that are walking around undiagnosed or untreated with airway disorders and have no idea about it. Tongue ties, that's one little piece of a puzzle. That's my focus, but my general focus is on public health and well-being. And our goal, we're working on a documentary series that it's in the process of being filmed, and we're hoping to wrap that up and maybe in the next year or so have it out, so that the public can become more aware. this is a collaborative effort. We have airway dentists like yourself. We have ear, nose, and throat doctors. We have cardiologists. We have from basically every walk of medical life who are understanding what's going on and not just practicing in our silos and trying to be, collaborate across the world to help, save lives and better the quality of lives.
Yeah, I hope that's gonna become true, because that awareness really, affecting all area of health. And as a dentist, we see it all the time. But I visit Sleep 2024, and I talk to a lot of medical practitioners. They don't see that way. They see one little area, and it's just totally different philosophy. We really appreciate your input and your, humanitarian effort, to bring this piece of knowledge to the humanity. And we're going to put information about you underneath this interview, and people can find you on the social media channel. And in case if they have, doubts about what to do, tongue tie or not tongue tie, you would be the great source to get that consultation. And I hope I'll be able to write something for New York Times and actually portray that situation differently, with more knowledge, and paint a different picture. So appreciate it. And we're going to put the link for a documentary series Breathless and Airway Revolution Foundation underneath this interview. So appreciate. Thank you very much for your time, Dr. Siegal.
Oh, thank you, Dr. Sokolina.